This is Dr. Sargsyan, and we will talk today about neoplasms and cancers. And this is a very important topic for everyone involved in healthcare, either someone in clinical practice or in clinical education or research. Thousands or even millions of people in the world are diagnosed with neoplasms every year, and hearing that you have a tumor may cause fear, dread, anxiety, upset, and not only for the patient but for the family. It's truly a changing turning point for everyone involved, including the healthcare provider. To most of us, this diagnosis may be equivalent to a death sentence. However, we need to remember that the neoplasms and cancers are treatable, at least some of them, and there is research continuing to find ways to treat most of the common neoplasm. So when we'd like to distinguish between neoplasm and tumor, these terms may be used interchangeably, and tumor, of course, more colloquial way to put it, and neoplasm is a new growth that can be either cancerous or benign. We still need to remember that not all the tumors and neoplasm are deadly, and not all of them are malignancies. However, again, approximately 1.3 million people are diagnosed in this country with malignant neoplasms every year, and this includes all types of cancers, treatable very well, and non-treatable. And of course, we need to know, for the purposes of this course and in general for your further development in practice, that which are the common cancer. So for men, prostate cancer is the most commonly diagnosed, and for women it's the breast cancer. Cancers, again, can be diagnosed many different ways, and one of the important points, the earlier cancer diagnosed, the better treatment can be. This is a generalization, but most of the time that works. And cancers are classified according to their appearance, growth patterns, and which is one of the important points here, type of body tissue, where they came from. Let's look at this diagram, and this is very schematic representation of malignant and benign neoplasm classification. So let's look on the top of it, and the neoplasm are involving both benign and malignant. Benign neoplasm are the neoplasm that are confined to a certain localized area, and they will not spread. Benign neoplasm, when you say tumor colloquially, most likely people mean a benign neoplasm, although again it can be reflecting a malignant cancer. So again, one of the important characteristics is that benign neoplasm, they are encapsulated, they are localized, they don't metastasize or they don't spread, and most of the time they are harmless unless they are growing in some type of confined space, such as a cranium, and or provide pressure on important blood vessel and cutting supply of blood and nutrients and oxygen to certain areas. So, but most of the time your benign neoplasm is harmless, and sometimes it can be a cosmetic defect, which is most people would like to remove. So malignant neoplasm or cancers, malignant deadly neoplasm will present with two main characteristics: invasions and metastasis. So invasion will happen to spreading of the neoplasm into local or surrounding tissue, and metastasis will be a spread to distant sites. Metastasis can happen via lymphatic venue or via the bloodstream. When we further would like to differentiate the neoplasm, would like to talk about tissue of origin. So according to the tissue from which they grow, we will classify them. We will classify them into the tissue type related classifications. Depending on the location of the tumor and origination site of the tumor, they may have different names. So benign tumors usually take tissue name and also suffix oma for tumor. So benign tumor will have suffix oma after the name of the tissue, such as lipoma. And lipoma, we know it's a tumor of fatty tissue. Malignancies will have, for instance, terms carcinoma or sarcoma added to the type of the tissue. So let's talk about differentiating between epithelial versus connective tissue malignancies. Epithelial tissue, if it's harboring a neoplasm, the non-malignant tumor will be named adenoma. If it's a malignant tumor, it gets the change in the name, and it will be changed to adenocarcinoma. In general, the epithelial tissue neoplasm, malignant neoplasm in this case, will be named carcinoma. Again, benign tumor of epithelial tissue is adenoma, malignant tumor is carcinoma. So when we are moving toward epithelial tissue, from epithelial tissue toward connective tissue tumors, so the differentiation in the names are changing. So benign tumor of connective tissue, such as bone, will be named osteoma. On the other hand, if it's becoming malignant, it will be osteosarcoma. So sarcoma is a term that you can use in connective tissue disorders and such as muscle, fat, and bone. And sarcomas are less common than carcinomas. However, the unfortunate event here that they would spread much more rapidly. So another type of tissue that doesn't have benign formations, benign neoplasm, it's lymphatic and blood-forming organs and lymphatic tissues, again, malignancies, and again, they don't have a benign variety, benign counterparts for changes for neoplasm. So these are lymphomas and leukemias, which are again malignant neoplasms of lymphatic and blood-forming organs, and lymphatic tissues. The leukemias and lymphomas can be, on one hand, very, very deadly and have high degree of mortality. On the other hand, depending on the variety, they may have very predictable and very not a benign but very favorable course of treatment and remission. Again, depends on the type of the cancer of this type. In other tissues, it can happen differently. So, and we can come up with different names for them. For instance, I know you all asked the question when I was talking about epithelial tissue, saying, oh, what about melanomas? What about melanomas? But melanoma, for instance, is a malignancy of melanocytes. So in case of melanoma, you cannot say carcinoma, like basal cell carcinoma. You would use the specific term as melanoma. So, or brain tumors, which are originating in glial cells of the brain, will be gliomas. So gliomas are benign in appearance. They do not metastasize. But they still considered malignant because most of the gliomas are fatal. So examples, again, adenoma will come up from glandular epithelium and it will be benign neoplasm. Something coming out from squamous epithelium will be epithelioma. Something coming from fat tissue is lipoma, and for instance, if fat tissue turns into malignant neoplasm, it will be liposarcoma. And these classifications are fairly clear-cut with the exceptions that I mentioned previously. When malignant neoplasm appears, usually some type of genetic mutation is to blame. Genetic mutation can take place secondary to disruption of genetic code by radiation, viruses, different carcinogens, or different chemicals. And we can have a big list of household chemicals, pesticides, herbicides, insecticides, they all may be presenting themselves as carcinogen. The research determined many other possibilities of carcinogens, such as burnt cooking oils and excess in certain dietary ingredients such as fat, trans fats, and all of these, all of the substances can be determined as carcinogens because they are cancer causing. The viruses and radiations, these are separate entities because they are not chemical structures and they cause genetic mutation by a different mechanism. But the end result is the same, and end result is disruption of the genetic code and development of malignant neoplasm. So malignant neoplasms do not have the structure and the purpose of the normal cells. Normal cells have a purpose, normal cells have controlled division, but cancer cells, they do not follow any pattern. It's difficult sometimes to even determine where the actual metastasis came from, what was the tissue of origin. oncogenesis occurs when cancer tissues actually grow, and to further define this, oncogenesis is a genetic mechanism where normal cells are transformed into cancerous cells. Carcinogenic agents will affect the DNA of the cell and lead to DNA damage, which eventually will result in malignancy. So the diagram here pictures how the damage occurs and how it affects the growth of the tissues and change into malignant neoplasm. The key point here is unregulated cell differentiation and growth. That's the main problem with cancer. We are having unregulated cell differentiation and growth. They steal nutrients and oxygen blood supply from other places in the body, and they uncontrollably grow. So malignant tumor takes over the body, which eventually results in death, of course, if it's not treated. So another problem with cancerous tissues or growth is tissue invasion and metastasis. So invading into surrounding tissue may damage vital organ and vital function, and this invasion occurs by a process of growing endings from the original tumor, as well as process of metastasis or seeding the cancerous cells into remote locations by using lymphatic supply or blood supply. Proto-oncogenes are normal genes that regulate cell growth. Oncogenes are mutations that lead to uncontrolled cell growth. The growth is autonomous because cell grows by itself. It's not regulated by any factors from the body. It doesn't obey the uniform program that the entire body obeys. So some of the oncogenes are growth factors, receptors, different enzymes, and transcription factors. Growth factors will bind to receptors on cell structure, which will activate signaling enzymes inside the cell, and that in turn activates special proteins that we call transcription factors inside of cell nucleus. The activated transcription factor will facilitate the turning on of the genes required for cell growth and proliferation. So they promote autonomous cell growth in cancer cells in the absence of normal growth promoting signals. So, and this can point because of the point mutations, chromosome translocations, or chromosome amplifications. Again, to recap this, that for cell to grow autonomously and uncontrollably, you need to have oncogenes present, and these oncogenes are factors, growth factors, signaling enzymes, transcription factors that would disrupt or would turn on the genes that required for cell growth and proliferation. So basically the whole process promotes uncontrolled growth. Tumor suppressor genes are brakes that body has to stop the cancerous or malignant growth, and they would stop normally a gene that's out of control. There are numbers and numbers of suppressor genes identified. One of the examples is p53 gene, and mutations in p53 can result in lung, breast, and colon cancer. The importance of this study and research of p53 mutations is that p53 again is p53 mutations are to blame for 3 leading types of cancer, again in lung, breast, and colon. So even a single genetic event can activate an oncogene, but remember that there are 2 copies of each gene from each parent, so it takes 2 hits to inactivate both copies of suppressor genes. So 2 mutations needs to occur. Loss of both alleles of a gene must be inactivated. This is referred to as a loss of heterozygosity. So, or shortly you can call it LOH. So loss of heterozygosity, it should happen to make all this process of genetic mutation of suppressor gene to occur. Again, remember, because we have 2 copies of each gene, we need 2 mutations to occur, which will lead to loss of heterozygosity. DNA repair occurs secondary to presence of cyclins. Cyclins are important in making sure that the cell produced the proteins needed for separation of the chromosomes. So cyclins will check that the DNA has been correctly duplicated, and cyclin proteins measure whether cell has growth large enough to divide. So basically cyclins regulate the whole process, but they are checkpoints, and cyclins need again to check the presence of the proteins necessary for chromosome separations. Cyclins check the duplication of the DNA and making sure that it's correct, and cyclins would measure that cell is big enough and large enough to divide.